You have probably heard about the coronavirus and you probably have a lot of questions about it. So let's look into it. I'm Dr.Mazhar Hussain. Please do subscribe to our channel, click the notification bell so that you're updated with our videos, and let us know if you want us to speak on a specific topic. We'll be talking about coronavirus. Coronavirus is basically a group of viruses, and they are more commonly seen in animals such as cats, cattle, bats, and so on. We know of 7 coronaviruses that also affect humans, and they cause human infection. It can also go from animals to humans, and there's suspicion now that it also goes from person to person, because we've had incidences of patients with the new coronavirus that had no animal contact. So we have other coronaviruses that have spread to humans. We had the severe acute respiratory syndrome, SARS, and we had the Middle East respiratory syndrome, MERS. The novel coronavirus, also called 2019 -NCOV, so 2019 novel coronavirus. We assume it's probably it's a spread of virus from bats to humans, but the verdict is still not final yet. But this is then the latest incidence we have of spread from animals to humans, and then we suspect it spreads from humans to humans. We'll talk about that in a bit. So how does it spread? About the coronavirus, we don't, the novel coronavirus that we are looking at presently, we don't really know for sure. It's simply too new for us to actually have established all the information we need. We don't have concise information about the novel virus. But what we do know about coronaviruses otherwise is it can spread from person to person in cases of close contact. And close contact in this situation is around 6 feet, 7 feet, 2 meters apart. And probably respiratory droplets can be spread when we sneeze or when we cough. It goes out in the room, and it can be then inhaled by other people, or it can also be that they have been in touch with the secretions that we cough or sneeze out. So if a person has it on their hands and bring their hands to the mouth, the nose, or the eyes, it could probably they could get infected. What we don't know for sure yet, but possibly there's also a contamination. There's also transmission from a contaminated surface or a contaminated object. For instance, maybe a handle, a pen, a mouse, or remote control. We don't know for sure whether that is one means of transmission, but it could be. And then the person, after touching a contaminated object, brings the virus to the mouth, nose, or possibly the eyes also. So the verdict is still out on this one. The data is still evolving about the epidemiology. We don't have full information, but some of the information we have we'll present here, and it will probably be something that will adjust in a few days' time, maybe, as more information and more data comes in. It's probably like it needs 4 to 7 days of incubation time, which means from the time that you contract the virus till you start having symptoms. That is the time span from 4 to 7 days. So you can have the infection, you can have gotten the virus, but you have no symptoms before maybe 4 to 7 days. The longest time from being infected to symptoms present has been in a case of 12.5 days. So this person could have been infected 12 days earlier, but presented with the symptoms 12 days later. Presently, the situation is that the number of people infected with the new coronavirus doubles every week, every 7 days. And on average, one person infects 2.2 persons. This is an average, of course. It will vary from patient to patient and what kind of environment they are in, whether they're traveling and they're in a congested area and so on. Let's talk about the symptoms. It's quite a bit like influenza symptoms-wise. 98% of the patients will develop fever, and nearly 3/4 of the patients will cough, and roughly half of the patients will experience myalgia, muscle pain and fatigue, tiredness. Less common is headaches and increased sputum production, and also in some patients we have seen diarrhea. More than half of the patients can develop dyspnea, and 2/3 of the patients will or can develop lymphopenia, which basically means that the lymphocytes, the number of lymphocytes go down. The lymphocytes are helpful to fight the virus infection. So lymphopenia is also a feature in coronavirus infection. Complications, again, the data is not really complete yet, and there are some suspicions that Chinese authorities may be withholding the actual numbers. But from the numbers, the information that we have now, it seems that it's less fatal than the SARS infection we had earlier. So 3.1% of the patients that are infected with the new coronavirus, they die from the infection, while with the SARS infection, we had 10% of the patients dying from the infection. There have been reports, quite a few, that maybe this number is not actually correct, and maybe the number of infected people is also not correct. The severe cases are more frequently seen with adult men above 40 years of age with comorbidities. In other words, that they are suffering from other illnesses which can weaken their body, weaken their immune system, and therefore they may not be able to withstand the coronavirus infection, and it may be a more fatal outcome. They may die from it. It also seems that the majority of the infected cases were men. So apart from the severity, it's also it's most severe in adult men above 40 years of age, but men seems to also be infected more frequently. As for a lot of other viruses, especially respiratory viruses, we don't actually have antiviral treatment for them. We don't actually have any kind of treatment where we just give that medicine and the virus is controlled and contained. What we can do is we can give supportive treatment as we do in influenza, SARS or MERS or many other viral infections. So primarily supportive treatment so that the patient can get through the infection and the body can then start fixing it. So supportive treatment while the patient is infected and has symptoms. Now, if you want to avoid, which probably most people would want to, if you want to avoid contracting the new coronavirus, then you certainly would want to try to avoid contact with patients. Also try to avoid touching your eyes, your nose or your mouth with unwashed hands. If you somehow have gotten the droplets on your hands, then you can bring that into your body, into your mucosal areas, and bring the infection to the virus into the body. If you cough or sneeze, make sure to do it in a towel and not a very thin towel, maybe a couple of towels. You don't want the secretions to go across the towel and infect your arm. If you don't have access to a towel, rather than sneezing out in the open, you might want to sneeze into your arm. That's better than sneezing out in the open. Remember, if you're using a tissue, to discard it afterwards. Face masks should be worn by patients. People that have symptoms should wear it. Healthy persons do not really need to use face masks, and they're ineffective. There's still a lot of access for the droplets to our respiratory system. but patients should be wearing it. Washing your hands, it's quite important, as we just talked about. You can bring it from your hands to your nose, eyes, and your mouth. So you need to wash your hands frequently, especially before or after having your hands close to the eyes, your nose or the mouth, or after going to the bathroom. Again, we don't know whether contaminated surfaces could be a source of infection. If you don't have access to, and when you wash your hands, you should do it for 20 seconds with soap, proper washing. Alternatively, if you don't have access to washing your hands, you can use alcohol-based sanitizer, and it should be minimum 60% alcohol in the sanitizer. So, if you suspect that you are infected, symptoms of being infected could be you have influenza-like or flu-like symptoms such as fever, cough, or you have difficulty breathing. If you suspect you are infected, and especially if you have these symptoms within 40 days after travel to China, or being exposed to someone that was suspected to have coronavirus, then you need to take a number of precautions for the sake of other people and for the sake of your dear ones. The reason we have the 14 days of exposure, post-exposure period, is basically because the longest we have experienced is 12.5 days from someone being infected to the symptoms presented. So we assume so far, we don't know for sure, but so far we assume that the longest incubation time is around 13 days maybe, so to be on the safe side, we are saying 14 days. Call your doctor, call the clinic, and inform them of your travel history, inform them that you suspect if you've been exposed to someone, inform them of your symptoms, follow the directions you are given by the clinic so that they know, and call them, don't go there directly. They should be ready to receive you and take their precautionary measures also. So follow the direction from the clinic. You should try to avoid contact to other people. So you're not going to work, you should not be going to uni, you should not be going to school, you should not be doing any sports activities. You should stay home. And if at home you live with other people, then you should stay in one room preferably, and if at all possible, you should be using your own bathroom, your own towel, so that other people are exposed the minimum to you and has minimum exposure to the virus. You should also be using a face mask. We'll get back to that. And you should not be traveling while you have symptoms. Again, we don't want other people to contract it. If you've gotten it, we would want others to avoid getting infected. If you are infected, then you should be using a face mask to minimize transmission to other people. People that are not infected do not need to use the face mask. Cover your nose and mouth with a tissue, or more than one. If they're thin tissues, you want to avoid transmitting the virus. Cover your mouth and nose when you sneeze or cough. If you don't have access to a tissue, you can use your arm and cough or sneeze into your arm so that the minimum number of droplets are introduced to the room. Make sure you have strict hand wash after coughing or sneezing, or after you blow your nose or pick your nose, and you should wash your hands for 20 seconds with soap. It's quite important how long the soap stays on your hands. Rather than the amount of soap, it's the duration of having soap to your hands that is important. If you don't have access to hand wash or soap, use alcohol-based sanitizers, and they should be minimum 60% alcohol. So this concludes our presentation of the coronavirus. If you have any questions, do speak to us. Subscribe to our channel, click the notification bell so that you're updated with our videos. And if you have suggestions for other subjects we should make videos on, do let us know. I'm Dr. Mazhar Hussain. Thank you.